Yes, once again, this is Obeng series, and I visit you with anatomy and some basic science of the orbit. As you can realize, the eyeball is found in a cavity, and that cavity is known as the orbit. So, this is the bony orbit. There's a lot of interesting things to learn about the bony orbit. So, this is it. It is made up of 7 major bones. These bones include the frontal, as you can see here, the zygoma, the maxilla, the lacrimal bone, the palatine, which is small here, the ethmoid bone. The last but not the least is the sphenoid bone. Okay, having spoken to you about the 7 bones which form the orbit, now let's talk about the margins that the orbital cavity is made up of. Of course, this is the superior margin, this is the lateral margin, this is the inferior margin, and this is the medial margin. Which bones constitute which margin? Alright, so the superior margin is made up of basically the frontal bone, as you can see here. Then we have the lateral margin. The lateral margin has 2 major parts, superior portion and inferior portion. So the superior portion of the lateral margin is made up of the frontal bone, while the inferior portion is made up of the zygoma. So we are now coming to talk about the inferior margin of the orbit. The lateral portion of the inferior margin is made up of the zygoma, whilst the medial portion is made up of the maxilla. Alright, so now let's talk about the medial margin. Superior portion of the medial margin is formed from the frontal bone, whilst the inferior margin is formed from 2 major bones. As you can realize, this is the maxilla and that is the lacrimal bone. Okay, so now let's shift our attention towards the walls of the orbit. The orbit has 4 major walls. The superior wall, also known as the roof of the orbit, the inferior wall, which is also known as the floor of the orbit, the lateral wall, which is the strongest of all the walls, and the medial wall, which is the weakest of all the walls. Yes, you have the orbital apex, okay, which is deeply found with major structures. So let's talk about the roof of the orbit. What are the major bones that are found there? It is obvious. The frontal bone is found more anteriorly, and as you go more posteriorly, you find the lesser wing of the sphenoid. So these 2 major bones constitute the roof of the orbit. I repeat, we have the frontal bone more anteriorly and then more posteriorly the lesser wing of the sphenoid, constituting the roof of the orbit. Okay, so now let's talk about the floor of the orbit. The floor of the orbit is made up of 3 major bones. Notable among them are laterally you have the zygoma, medially the maxilla, and of course posteriorly you have the palatine bone. These 3 bones are forming the floor of the orbit. We now come to talk about the lateral wall of the orbit. This wall is made up of 2 major bones. More anteriorly, there is the zygoma or the zygomatic bone, and more posteriorly, we have the greater wing of the sphenoid. So these 2 bones are found forming the lateral wall of the orbit. Let's now shift our attention to the medial wall of the orbit, which is made up of four major bones. Notable amongst them are the maxilla, which is found here, okay, the lacrimal bone, which is also found here. We have the ethmoidal bone, is one of the bones found in the medial wall. The last but not the least is the lesser wing of the sphenoid, also forming the medial wall of the orbit. So it's also important to talk about certain important anatomical structures that are found at the lateral wall. So we have what we call Whitney's tubercle or lateral orbital tubercle. It is called Whitney's tubercle or lateral orbital tubercle. What is it? This is a tubercle or anatomical eminence which is found 11 millimeters below the frontozygomatic suture. The frontozygomatic suture being an opening, a physiological or anatomical opening between the frontal bone and then the zygoma. So between these two bones, we have this suture, which is known as what? Frontozygomatic suture. That word may sound a bit strange, but it's made up of two major words, the frontal bone and the zygoma, making it frontozygomatic suture. This is found 11 millimeters. So I'm talking about Whitney's tubercle, also known as what? The lateral orbital tubercle. So this tubercle is found 11 millimeters below the frontozygomatic suture. So there are certain important anatomical structures that this particular tubercle contains. What are they? These are the lateral palpebral ligament. Okay, it also contains the suspensory ligament of the eyeball. It also contains the lateral ligament for the lateral rectus muscle. It also contains aponeurosis of the lateral aponeurosis of the levator muscle. It's also important to talk about certain orifices, openings, apertures, or fissures which are found within the orbital cavity. So, what are they? So, you have the optical canal or optic canal, also known as the optic foramen. It's good to know all these names because different books with different authors may use different nomenclature. So, it's called the optic canal, optical canal, or optic foramen. Again, we have another orifice or fissure or opening here. And remember, I told you different authors in different books may use different nomenclature. So it's good to know all these important names. So this is known as the superior orbital fissure. It is what separates the lesser from the greater wing of the sphenoid. And so the superior orbital fissure is found lateral to and inferior to the optical canal. So inferior to the superior orbital fissure is another fissure, as the name goes. If this is superior, then of course this other one will be what? Inferior orbital fissure. So finding itself below the superior orbital fissure is the inferior orbital fissure. Remember that these fissures, openings, or apertures within the orbit are not just there for being their sake. They help in transmission of certain important anatomical details. Let's start with the contents or the structures which the optic canal transmits. So it transmits three major structures. One, is the optic nerve. So the optic nerve. Okay, so there is a structure which helps in feeding the optic nerve so that it doesn't become ischemic. So that is known as what? The ophthalmic artery. And of course, there are certain nerves, we call them sympathetic nerves, from where the carotid plexus. So the optic canal transmits three major structures: the optic nerve, the ophthalmic artery, which is a branch of the trigeminal nerve, and it also transmits sympathetic nerves from the carotid plexus. So now let's talk about the superior orbital fissure. So it has two major portions: the upper part and then the lower part of the superior orbital fissure. The upper part transmits the lacrimal nerve, the frontal nerve, and the trochlear nerve, which is also known as well the fourth cranial nerve. So remember, the lacrimal nerve, the frontal nerve, and the trochlear nerve. The trochlear nerve is also known as the fourth cranial nerve. So frontal nerve and lacrimal nerve are branches of the ophthalmic nerve. So what does the inferior portion of the superior orbital fissure transmit? It transmits one, nasociliary nerve, which is also a branch of the ophthalmic nerve. It also transmits the third cranial nerve, also known as the oculomotor nerve. It also helps in transmission of the abducent nerve, which is also known as the sixth cranial nerve. It also helps in transmission of the sympathetic nerves from the carotid plexus. The last but not the least structure it transmits is the superior ophthalmic vein. Now let's draw our attention to the inferior orbital fissure. So it also helps in transmission of certain important structures. So these structures include the maxillary nerve. It also helps in transmission of pterygoid nerve. Again, it helps in transmission of pterygopalatine nerve. The last but not the least structure it helps in its transmission is the inferior ophthalmic vein. So once again, I want to thank you very much. This is Obeng series. I'll visit you again with another basic science that will make it more exciting. So until I see you again, learn very well until we meet again. Thank you.